everyone. It's June 24th, 2025. This is Talk Back. And today we're going to continue our series on the important things about what we need as we grow older. And my brother, I'm so happy to say, is someone who can give us some expert talk about that. He is a naturopathic doctor, a mind body expert, and he has a practice in Westport, Connecticut, is a lecturer, workshopper, has written a book, and is very active in trying to raise the consciousness of everyone in this country on what naturopathic medicine is, what mind body medicine is. And Paul, welcome to my program.
Thank you, Sheila. Good to be here. Good to be back.
Okay. And you've impressed upon me this one quote that we're going to have as a centerpiece of this program. And I'm going to read it aloud, and then we've got it on PowerPoint, and then we're repeating it at the very end because you think it's so important. So this is the quote: "You, the individual, can do more for your own health than any doctor, any drug, any exotic medical device." So, Paul, as a way of introducing us, who said that and why is that important?
That was a quote by Joseph Califano, who was Secretary of HEW during the Carter administration. And they commissioned a research study that they called Healthy People, Disease Prevention and Health Promotion. And they were exploring and trying to understand how they can improve the lives and health and aging of Americans, of our country. And they were exploring the leading causes of death: heart disease, cancer, diabetes, which sadly, 50 years later, are still the leading causes of death in our society. But that quote came out of recognizing that with everything that we have relative to good medicine and good doctors and good treatments and good diagnosis and good drugs and good natural medicine and whatever other factors may be there, perhaps the most powerful medicine, and this was back in the 70s, was we could do as individuals to take care of ourselves, to be healthier, to prevent those diseases, to lead a happier, healthier, longer life. As I've aged, I've been speaking and teaching at senior centers, and I have a class at the Westport Center for Senior Activities for 20 years as I'm teaching myself what I need to learn to stay healthy and happy as I age, to live a longer, healthier life. In the context of healthy aging, we are all aging from 2 to 90. And the best way to have healthy aging is to have healthy living. And the basics of that haven't changed. We have more knowledge and information specifically about what that can be. So for me, that was inspiring because it came at a time in my life when I was exploring my careers and I had chosen to return to school to become a doctor. I wasn't sure what kind of doctor as I went back for pre med, but that quote inspired me, as did my personal journey, healing journey, spiritual journey in the studies and practice of yoga, mind and body. And I became a yoga teacher. And in that regard, I was teaching yoga, the 5 points of yoga, similar to what we'll speak about later, the 6 pillars of healthy aging. And in yoga practice, it was proper exercise and proper diet and proper breathing and proper meditation, etc. And I was just teaching yoga, but I was watching people heal themselves. This is in the 70s. And it was quite interesting, intriguing, exciting for me because people were taking responsibility. They had various ailments, as we all do: asthma, allergies, arthritis, and they were seeking support. And they had doctors and they had treatments, but they found that they're taking responsibility and changing their lifestyles, their attitudes, their beliefs in how they were living became important factors in getting well. So from there, I chose to become a naturopathic doctor, where our role is to support people to heal themselves, both with our medicines Chinese medicine, homeopathic medicine, herbal medicine, nutrition, diet, supplements, physical medicine. I chose mind body medicine, counseling, awareness, consciousness, that people's attitudes, their beliefs, their stresses were also key factors in what contributed to their illness, but were also key factors in them getting well, in them healing. So while everything else is important, the right doctor, the right diagnosis, the right treatment, the part that we play in our health is critical. More importantly, as we age, there's a little less for prevention. A lot of it is baked in our genetics, our lifestyle, how we've lived. So it's even more important as we age to both get good medicine and good diagnosis and treatment, but to recognize how important it is to recognize in a positive way what we can do. And that for people is hopeful, it's empowering, they feel they're able to do something. And it's as if they see with new eyes that aging and growing old is not a disease. It's not something we have to run away from. We can simply allow ourselves to um, go forward and make new choices and move in a new direction of our health. In that context, our illness becomes the very vehicle and opportunity for us to change.
Okay.
So that's the work that I do to help people listen and look inside and explore what's happening.
Okay, so let's go back to many, many years when you and I were growing up, and we relied on, I think it was Dr. Goldsmith, and he sometimes came to the house. But the
Sorry.
way we looked at medicine back then was the doctor was all knowing. He was your oracle. He was your advisor, and you didn't have a role to play on your own. You listened to what he said. So tell me, Paul, over all these past 50 years of living and your education, how not just have you changed with mind body medicine, how has our country changed, our community, our world changed to accept more of the ideas that you now think are important?
Well, that has evolved and has come more into the mainstream. I wouldn't call it mainstream, but people obviously recognize the value of a healthy diet, of exercise, of dealing with their stress in the world that we live in and the fast paced. And I would say that another inspiration for me when I was speaking and teaching at the University of Virginia School of Family Medicine, I did some research in the 90s. They did a study that 90% of visits to the family doctor that you're speaking of, our family doctor, was for stress related complaints. Yes, we had headaches and stomach aches and rashes and hives and this and that, but underneath the symptom at its root cause often were lifestyle factors. Chief among them was stress in our life, some of which that we had dealt with and processed and moved through, some of which we carried. The body mind, it bears the burden of the stresses and traumas that we live in childhood. I may treat somebody 50, 60, 70, 80 years old. They're still carrying what happened in first grade with the student that bullied them, or the negative message that they got from someone about how they'll never make it in a certain way. Some of these wounds live in us, and they show up in the doctor's office, and they need evaluation and diagnosis and treatment again. But the question becomes, where is the healing and what role can I play in that? And as we age, that role becomes even more important. There's no cure for getting to be 80 and 90 and 100. There's no magic pill. Even with Alzheimer's and the research we're looking for, even to prevent all of our delays, and we're looking for the magic pill and special supplement that people spend millions of dollars on. What we'll speak about is more critical and more important, which is how are you living? They have studies. I just brought in a couple of books. I teach classes on healthy aging, on longevity, on how to have a healthy brain. So I've done all of the research on it, and they're all saying the exact same thing, each in a little different way, with a little more specialty. And again, from 2 to 90, you need individualize and customize what this writes for you. So this is a book just to show there are books on the topic. The Ageless Revolution. You can find 100 books on longevity, on healthy aging, and this is another book just to use it as an example. The Age Proof Brain. And paradoxically, these two books and the approaches are the same ones that Califano spoke about in 1979 to
Right.
prevent. Go to the Heart Disease Association, the Lung Association,
Right.
the Diabetes Association, the Cancer Society. You know what they're going to tell you? Eat a healthy diet, take a walk, deal with your stress, etc. And we can go into a little greater detail.
Okay.
It's simplistic, but
Right. But I think what's important from the perspective that we want to get across to everyone
sure.
is that uh, whereas so many of us falsely say, well, I've got my ulcer. That's one part of my body. I'll deal with that. Oh, I
Right.
got my heart. Oh, I got my gallbladder.
Yes.
And everything's disconnected, and we have a different doctor for every part of the body. What you're saying is it's all connected.
It's
It's
all
all one part. It's holistic, and we have to understand how it's connected and how our
yes.
stresses and psychology are connected to that. I think that's the main thing that I think you're talking about with mind
Yes.
body. And I love the quote that you always have said about it is that the body bears the
The
burden.
bird.
So
Yes.
explain what that means. What does
So
that mean?
my work over the years has evolved into how your biography becomes your biology and integrating your biology and biography in care. That's not me taking over for the cardiologist, but that's me integrating the other issues with the cardiologist or the doctor treating whatever other condition you may have with whatever approaches they may use. So I put in using the analogy of a healing soup, which may have many ingredients. So many of my patients in Fairfield County in Westport have wonderful ingredients in their healing soup. They're seeing the best cardiologists and the best neurologists and the best naturopath and the best herbalist and the best therapist. And all of those ingredients are in their soup, and it's wonderful soup. And I wouldn't change an ingredient, and we don't throw it out. But when they're in my office, something's not working. It's like any soup. You could have most organic, freshest ingredients that you get at every specialty store, and you put it in the pot. But if it's there's something missing and it doesn't have the right touch of salt, all those ingredients they're doing their thing, but they're not coming together in a whole. In that context, that's my work. Number one, to integrate the mind body connection that may be needed in that soup, like disease tells a story not just of your cells and your diagnosis, but it tells the story of your life. Are you willing to listen to that in addition to what the blood says and the x-ray says? We need to listen to both stories. We need to treat both the biology and the biography. But the most important ingredient, back to Califano, is you, the individual. You must be in your own soup. And Sheila, you know this because when mom died, we cooked her soup and it was delicious, and we followed her recipe, and she was watching, and you videoed it, and it was from letter to letter. It was exactly the way she would want us to cook her soup on her stove from her butcher, from her
Right.
our chicken soup that we had Friday nights, and it was delicious soup. But a bulb went off in me because it wasn't mom's chicken soup. I don't know what she put in it. But that's the point. There's something that people need to put in their healing soup, in their life, some ingredient. And an important element here is to recognize that healing is natural and learning is natural. The brain is constantly learning. The good news in that it's learned some things we want to try to forget. But the body remembers what the mind's trying to forget. But
Right.
we can change the brain with mindfulness, which is another skill, tool, therapy that when I started wasn't therapy, it was my practice to calm myself down, to help me heal my wounds and my pain, to be with my struggles and challenges in life
So
through
what is
mindfulness and
mindfulness?
yoga.
Define mindfulness.
Mindfulness is the moment to moment observation of your mind body process with non judgment. Basically, what's happening now in my mind, in my body, in my heart, without judging, without trying to fix it or change it, to see it with new eyes, to step back. It's like training a puppy dog to stay by your side, to pay attention, to see what's happening. The beauty of mindfulness, it calms you down, it changes your brain, it can help you see more clearly so you can respond instead of react. We can all get caught in those things. And at some point, we have to then see clearly and make wiser choices. So, mindfulness as a therapeutic tool is pretty much listening to yourself, welcoming what is there, embracing it like you would a child who's wounded. Of course, we don't want it to be in pain and we don't want them to cry. We want to find what are you crying about? We want to get to the bottom of it, but we bring to it a compassionate presence, a listening. My own definition of healing is healing your relationship with yourself. It's can I be with my mind and my body, with my fears and my anxiety and my pains and my struggles and my reactions? Can I see the truth of me? And if and as I do that, maybe I have a chance to face the world out there and all the buttons that get pushed in us. And we're just a series of reactors. And one of the
Right.
reasons the world is kind of
So you want us to
going to hell in a handbasket, sort
take
of.
responsibility for our own health, right?
Well,
We're gonna,
the challenge there, it's not, it's, I'm not preaching here. I mean, I'm passionate and it's my life's work and I'm committed to it and I have a mission, but I don't want to sound like I'm preaching. The work is to help people see their truth so they choose to take responsibility. I'm not telling you you have to take responsibility, but I want to help you be
well,
aware that you have options, you have choices. How many patients have I seen going to the wonderful doctors that I would go to with the same condition? But there's an element of it where the doctor says to the patient, I don't know what else is happening. I don't know. Nothing else can be done. And I hear that continually. And
right,
then they're on a never ending search for somebody to come up with a magic cure.
right.
The issue is
And you,
don't stop looking for the magic cure, but at the same time, hey, maybe there are things, maybe I can deal with my stress better. Maybe I can heal some of my old wounds. Maybe I can forgive someone. Maybe I can take a walk. Maybe I can work more with my career and my job. Maybe I can whatever.
right.
But
Can can you
the,
see
the,
the
the, the the
slide?
last
Can you
point,
see the
definition of let me show the slide.
can you see the slides?
Yes, I do. I can hear the slide.
You can keep talking because we can see you on the slides at the same
Okay.
time. So yeah,
Yeah. So that the main key there is it's not either or. And the challenge in mindfulness, in willing to see and listen to the truth, it's often a painful truth. This is the challenge that I've learned for me personally as well as my patients. We'd like to go, oh, I'm going to meditate and I'm going to sleep better. Yes. And I'll be more relaxed. Yes. And I'll have less stress. Yes. But it doesn't automatically cure and fix and unburden you from the traumas and burdens that you've had. For those, there's the work of Alice Miller who talks about childhood and the prisoner of childhood, and she talks about the liberating experience of facing painful truth. So the way that I work with people is not, oh, you need to change your diet and you need to meditate and you need to take a walk. Yes, that's obvious, but it's more help them listen. My living questions are you willing to listen to what's happening? Are you willing to find out how you got like this? What's this really about? And can you be with it with wisdom and courage? And when people are able and willing to look at their illness that way with new eyes, as they're able to do that, with that awareness, they make wiser choices. They make the choice What can I do? Can I take a walk? Can I do yoga? Can I go to the gym? They make a choice. Can I go back to church and pray? Should I knit? Should I ride my bicycle? Should I forgive my relative that I haven't spoken to? What do I need to
Okay.
engage in my journey of healing?
Okay,
Viktor
Paul.
Frankl.
Right, Paul.
Yes.
Mind body integrative medicine.
Yes.
Is that another word for holistic?
Yes.
Or
I mean,
yes,
well, that's my personal definition to define what I do, which is mind body, but I integrate it in the healing soup. So I put it together. This is all on my website.
right,
We listen to the symptoms and to the story behind them as our guide to treat the cell and the self. That's the integration. The mind body is that when you're stressed, it affects your body. And your body also affects your mind. We now know with the mind body brain connection, the brain gut connection. People with issues in their gut have stress, and the stress affects our gut. And it's kind of a symbiotic relationship that we have to treat both the mind and the body and mix them together in an integrated way in that healing soup. You, just the right ingredients. I see many people who are doing wonderfully with their individual ingredients. But if they end up in my office, it hasn't been brought together yet. Just like you need a main chef in the kitchen. I watch some of the shows. Uh, the head chef, and he's got this one's making the hors d'oeuvres, and this one's doing that. But to put the dinner together, somebody has to be looking at the whole. And
right,
so that's another context to engage people and engage their consciousness to recognize their power. One final point, the mind itself, back to neuroplasticity, which we have a slide on, the mind itself changes as we age. And research is showing that mindfulness meditation scientifically will lower your blood pressure through practice in the same way a pill might, with different mechanism. That's not don't take your pill and just meditate. You do both, and maybe you won't need a pill. But that's working with your doctor.
right,
Again, it's an integrated, customized approach with the patient at the center. And
right.
the most important ingredient in the soup. We talk about it, we say it, but it's not easy to put into practice.
Okay, so a couple of
Sure.
thoughts on that. In our way of our healthcare system
Yes.
today, with insurance, with every different thing that you need to do to
Yes.
go to a different place, a different person, a different doctor, a different procedure, makes it harder to do the integrative. And why shouldn't we all have our primary care physician to help us be our manager like you are, to help us to figure out the wholeness of what we need in our health. I
Well,
don't think my personal care physician really does that for me. She collects all my information, but
okay.
I need somebody like
Right.
you, right? Shouldn't everybody have a coach to help them like
Well,
you to integrate?
there's different elements that you're mentioning. Okay. First and foremost, the point here is not to negate or judge or criticize what is happening. That's number one. Meaning, take what you want, leave the rest, take in the good. Focus on what your GP is giving you, what your specialists are giving you, and value it and appreciate it rather than bemoan what they can't. I fell into that trap early in my career, and it wasn't helpful for me or my patients or my speaking because I was right, but so what? It wasn't helpful. So in this context, rather than they should, they don't and they can't and they won't. That's not a judgment or a blame. That's to say, how can I find that support that I need by maybe asking some of the practitioners I see to provide a little bit of that and say, could you talk to me a little bit more, a little more bedside manner, a little more understanding, a little more involvement? What can I do? Number one. You mentioned a healing coach. I'm not a coach. I'm a doctor. This is medicine. This approach, when you change how you look at it and be with it, it changes. So, yes, one role I play, which is why I chose my profession, is a doctor as a teacher, doctor as a coach, doctor to integrate all of it. And then my specialty to put in the soup is the mind body connection. So we're
Right.
integrating a number of pieces. You can see a practitioner that requires to spend a little more time, a little different relationship. I've chosen to practice pretty much like a therapist, to spend an hour with my patients so I don't rush and I'm not pushing anything away. So we have the time to look at it, to be with it, to explore it, to put the pieces together, to see that no stone is going unturned, as it were, and to value and appreciate the doctor, the drug, the surgery, the diagnosis, the research, the treatment. That's an important ingredient in the soup, but it's only
Okay.
one ingredient.
All
It's not
right.
the most important ingredient
So now
necessarily.
we have this. Here we go again with the Califano quote, which
Okay,
we'll
continue.
repeat. We'll repeat again. And I know you like to have these sayings, which are very inspirational,
This
right?
is my saying
Yeah,
in
you
an
said
article
it,
I wrote
right?
in what do you call it? Spirituality and Health magazine
Right,
back in the 90s. In curing, it was called the Journey of Naturopath Paul Epstein. In curing, we look for answers. In healing, we live questions and look and trust that the insight will come. The challenge in medicine is not the choice between one or the other. We need both.
got it.
Um, that's my reading is off because I'm aging and I'm due for cataract surgery.
Okay,
And this is a favorite quote of mine. The journey of discovery consists not in seeking new landscapes, it is in seeing with new eyes. I teach my class at the senior center. I ask people, everybody's got something. Nobody's in there without an ache or a pain or a wound or the death of a loved one or some wound or grief in life. Nobody's in there who hasn't been resilient to get to that class on a Thursday morning for the last 20 years at the senior center. But everybody thinks they are the only ones with their stuff. And the healing is how to oi without the vey, which was a phrase of my bubby. How to be with the difficulty without complaining about it. You got it. Love the one you're with. Learn to be with it. Learn to welcome it. Learn to let it teach you because you're going to get something else. And if you didn't have that, you'd have something else. So then I asked the class, 25, 30 people, they look around the room. I say, see somebody if you want to trade with them. You give them
right.
your stuff, you'll take theirs. Nobody wants to trade. You don't know what they got. Everybody's got something. And the biggest responsibility is to own it and welcome it and love it. It's part of life. It is life. And we're all in it. And we have our own destiny and our own journey and the challenges, how to be with it. I was telling you the Viktor Frankl quote from his book Man's Search for Meaning. Very important quote that I use in my teaching at the senior center. Everything can be taken from a person but one thing. The last of human freemen, your right to choose one's
Choose,
own way
right?
in any given set of circumstances. My work with people really is helping them be aware that they have new choices, new resources, and can see with new eyes. Once that light has been turned on, they don't need me to tell them don't eat at McDonald's every day and stop having Dunkin' Donuts in the morning. I don't need to tell people that. What I need to help them inspire themselves is to choose that path, to add years to your life, add life to your years. And if you want to live, you got to be healthy. So
Okay. Oh,
as
you
we
just
age,
said it.
it's more
Yeah,
important. Oh, that quote came on.
yeah.
There you go.
You
Yeah.
just said it. So we that was a good work. And now you wrote this book. Tell us about this book that you wrote.
I wrote a book. I was a meditation teacher. I am a meditation teacher. Mindfulness and yoga were instrumental in my life. And what was interesting about it is when I went through medical school and learned all of these therapies and nutrition and herbs and homeopathy and Chinese medicine and the like, I was always interested in the mind and consciousness. And then the more that I practiced and learned, And the more the research came out on the mind body connection and the sciences of psychoneuroimmunology and epigenetics and um, the ability and ACEs and childhood trauma, the more I realized that these approaches that I had practiced personally were actually important therapies that this research and science was showing their effect on health and healing when we work with the mind and body in these ways. So I wrote this little book from the spirit of having been a meditation teacher for years. I still am. And I talk about the instructions of how to face what's happening, how to have an intention of a beginner's mind, of non judgment, of patience. You're my sister, so you know we teach what we need to learn. So I'm still learning and I'm still growing and I'm still healing because that's the nature of the beast. And mindfulness, uh, the goal here is happiness. I think of people like Tuesdays with Maury. Whenever I use that phrase in a lecture or with a patient, they smile. And somehow somebody talking about not a pleasant disease to have or to die from or to live with, but somehow the way he had that disease inspired people. Or
Right.
Stephen Hawking's,
Right.
or Michael J. Fox with Parkinson's. I have some
Right.
friends who've sadly develop Parkinson's, and it's not sad because they're doing fine with it and they have a positive attitude and they're working with it. I have
Right.
people in my class 103 years old. I'm humbled to open my mouth when I speak,
Right.
and they're 100. And I'm talking about healthy aging, uh,
Right.
and so there's this quality of resilience, and what's important in that sense is happiness and longevity are important, and they studied the blue zones and the places in the world where people live longer. It's not high tech. It's simple. It's healthy living.
Right.
It's fresh air. It's being in a community. It's having meaning and purpose
Right.
in one's life that is both treatment, prevention, opt-
Right.
optimization, and wellness. And that's kind of what I've wanted to integrate, and the medicine is there from Califano to today. The power of these medicines
Okay.
integrated with
Right.
looking for the doctor and the treatment and the
Right. So
and
you're
the right
talking about
tools.
people who are older that we know, the 103-year-old, the
Sure.
99-year-old. Somehow they are able to be graceful as they age, to have courage in facing the diseases. Even when death is around the
Yes.
corner, they're able to be almost royalty in the way that they live their lives.
Yes.
Not all of us can achieve that, but
Well,
those
they come to
people
my
are
class for the last 20 years. What do
those,
you
yeah,
expect?
okay. Those people are our models that we have to try and
They're my
follow.
teachers. They started as
Right.
my students, and they're applying what I'm teaching, and it
Okay.
works for
Okay.
them.
You mentioned neuroplasticity. What
Yes.
is that?
Okay. Uh, oh boy. What I'm
Just
going
the
to
brief.
say,
Yeah.
yeah, go to the next one. There's the next slide on neuroplasticity. Yeah, this one. Um, Neuroplasticity is understanding the science that the brain is always changing and it learns. It's learning. We used to think the brain is growing and developing, and a child brain and a teenage brain, and when you get to a certain age, that's it. We're done. No, the reason why we can stay younger, why we can get a healthier brain is because the brain is still learning. The question is, what are we teaching it? The question is, how are we changing the brain? Mindfulness creates new neural pathways. Right? The neurons that fire together, wire together. When I bring love and compassion and awareness and presence and kindness to pain, to suffering, to hurt, when I integrate those two things, it actually changes the brain and makes ourselves more resilient in a global way and on a cellular level. We now understand something called epigenetics, that the brain can be changed and the cells can alter at the genetic level with mindfulness and yoga, as I shared. So the practice of mindfulness or yoga, it's relaxing. It has its effects on the nervous system, on the endocrine system. We're now studying its effects on the cellular level to actually create new pathways in the brain. That's
Mhm.
beautiful. We can change. We don't have to stay stuck. We get hardened. We have to keep moving. That may be the key phrase for healthy aging, whether a baby is moving to learn how to walk or a senior is moving to deal with their joints that are tighter and more fixed or with some uh, inflammation and arthritis. But we need movement, and mindfulness creates the space for us to move and change our brains. That's what's exciting. The paradox is we don't necessarily do it to get the change the way the change happens by being with things as they are, which is a paradox, an ultimate paradox.
All right. So I'm
So it's
looking at
not,
the last comment on that slide is
yes,
neuroplasticity can have negative too. So it makes
yes.
your brain resilient, but it could be resilient for taking in negative stuff.
Well, because
So
I may sound some simplistic, but there are many people who were told by teachers or caregivers or parents in mean ways they were abused or abandoned or neglected or enmeshed in some way in relationships. And they grew up hearing voices saying to them, "You're no good,"
yeah.
or "You'll never amount to anything," or "You're this," or "You're that," or they blame this, or they tell themselves it's their fault. And until we see the weeds that we've planted that grew, deep roots of weeds of shame, of grief, of anger. This is what PTSD is. We go through these traumas, and when we don't heal them, when the trauma is over and we carry it with us and we don't face it, it lives in us. It lives in the body, it lives in our mind. And the healing is to slowly process and release them in different ways. There's a lot of different tools and techniques. There's no one answer. I'm not presenting the cure all for it, but it's a process that neuroplasticity helps facilitate in the sense that the brain can change. So when you ask that question before I address this slide, Sheila, when you ask the question of how is or are things changing in medicine, we're starting to understand even more. We've already known the role of stress, but we're not talking stress management. That's in the now. We're talking about freeing ourselves from the stresses and traumas that we carry, that our parents may have carried, that our ancestors may have carried. We just celebrated Juneteenth. If you're a black person in America, in your genes is the effect of slavery on black people in America. As a Jew, with what's happening in Israel, they're we're affected by the trauma of the Holocaust, even if we didn't live through it. It's in our genes, epigenetically, and it's part of the healing. Sadly, the people in Gaza now, the Palestinians, are suffering the traumas in ways that will live with them uh, in their life and their children from an ancestral standpoint. This is not woo woo anymore. This is science. We understand the mind body connection. We understand the biography biology connection. We understand about stress and trauma. The number one cause of death for soldiers is suicide. And
Mm.
paradoxically, a positive story to share about that was I was watching Anderson Cooper on TV, and they're always doing studies of soldiers. I think it was around Memorial Day, maybe a couple of years ago, and they were interviewing this woman who had been a sergeant in the Air Force or in the military during Iran, Iraq, and she had been through a number of tours of duty. And obviously, we know about the stress and traumas of living through that. She lived through it, and she was injured, and some of her fellow sister soldiers had been killed, and she was a platoon leader. And she talked about her story and got addicted to pain pills and alcohol, and and was telling her story and being interviewed as a poster soldier child for a new program the army was trying to help soldiers deal with PTSD, therapy dogs for soldiers.
Mm.
And she had this dog next to her. She told this horrible tale of woe. and very inspiring. She was there with a smile on her face after all she had been through. And she looked at this dog on the ground and she said, "This dog saved my life. If
Mm.
it wasn't for this dog, I wouldn't be here." And I was saying to myself, seriously and jokingly, what the holy, I'm spending my career studying this and learning that and this technique and that technique and
Oh,
IFS and how to treat this and how to treat that and what technique and EMDR and QXA and B, and all it takes is to be a dog and love, and it was the love
yeah,
and connection that she got that was the medicine. It
right,
healed her, and
right,
we're looking for fix it and cure it and heal it, and I look for it too, of course. But
right,
on another level, it's as simple as the mom and dad holding their baby in their arms and saying, "It's okay, I'm here.
right.
It's
Well,
okay."
there's a whole profession of pet psychology and the relationship to
Sure, of
our
course.
fears, our hopes, our dreams.
Yes.
Yeah. All right, let's
And
go on.
let me tell this thing, but one last piece. Yes, my work is I train and mentor doctors and therapists to bring this piece of it. They don't have to be me and my approach per se, but to bring elements of it into their work to recognize this element is important. Doctors can ask the questions that we're going to go to in a moment, but I'm going to go through this quickly. This is a pyramid of exemplifying the ACE study, adverse childhood events, where it has been researched and found that the number one predictor of chronic disease, why you have heart disease, cancer, and diabetes at the end of life or as it's developing, one contributing factor, a main one, and a predictor is childhood trauma, is what you grew up with, abuse and abandonment. And at the bottom of this pyramid is adverse childhood experiences from conception to death. Even people who are in the womb, Sheila, as a matrimonial lawyer, what families and children go through when their parents are going divorced or they're pregnant and the mother is going through tremendous stress and trauma, going through horrible divorces and domestic violence and the like. This has lasting legacy, and it shows up in doctors' offices who say you have heart disease and you have cancer, and they need to treat it, and they're right about the disease. But this chart is inspiring for me because it shows the core of what the cause is. Childhood experiences that causes disruptive neurodevelopment, that causes social, emotional, and cognitive impairment, that shows leads to adoption of health risk behaviors, of addiction and difficulties with this and that, and then comes diseases, disability, and social problems. This is where our health system starts with therapists and doctors, and then there's early death, where we come in, meaning where we the individual come in is recognizing our story, what happened to us, and getting support all along the way to see how those factors got us up to the top of the pyramid. And it's never too late to have a happy childhood. Doesn't mean you need to go into years of therapy, but you want to know where I come from, what happened to me. You and I, we went to Normandy to visit where our dad was a soldier in World War II to find out what happened. This happens to be PTSD Awareness Month. So this was a big factor in my life and yours growing up with someone who had PTSD from World War II and not knowing at the time how it might affect us, each in our own way. And each of us
Post
coming forth
traumatic.
with that
What is,
stress,
make sure everybody knows what PTSD means. What does it stand for?
post traumatic stress disorder,
Disorder. Right.
which means
Okay.
is we live through the trauma, we survive the trauma, but then the post trauma stress that we carry with us becomes a disorder, and it shows up in our bodies, in our minds, and ends up in our doctors and therapists' offices with ailments. This is the essential mind-body connection. And that challenges, like you said, how does the healthcare find a way to address all parts of the person? Because it's all involved. And as a naturopathic doctor, our key focus is on treating the underlying cause. How'd you get like that? These are the questions. There is a branch now of medicine where doctors were moving from what's called holistic, complementary. They're using the phrase functional medicine. They want to own medicine more to recognize the root cause. And stress and trauma is a root cause, as well as diet, etc. So these are everything I've shared with you today has been summarized or integrated or evolved into these three living questions, which covers everything we've spoken about and more. We only had an hour. I have modules and programs I've been training doctors to integrate these aspects for years. But these are the questions that I train doctors to ask, that I suggest patients ask, that I think your GP could ask if they chose to. They could say to you, "How did you come to be this way, Sheila? What do you think your stomach ache is about? What do you think your ailment's about?" Write a story. You reflect on it. Live these questions. Number two, are you willing to listen with the ears of your heart to the other voices of yourself speaking? Maybe your symptom, maybe your pain, maybe your illness, it is carrying a burden. Maybe there's a message there. Maybe if you listen, it will tell you, it will express it. So there's a new therapy that I've been trained in internal family systems therapy, where we speak to parts of us, where we speak to the wound, where we speak to the part of us that carries the shame or the hurt or the trauma. And we listen to it, and it tells us, "I'm hurting." And it's saying to us, "Thank you for listening. Nobody ever listened to me." I went and I see patients who going to the best doctors. Not don't go to the doctor, getting the best treatment, but nobody's living these questions with them. Nobody's connecting them to the truth of what it's really about. No one's giving them an opportunity to find new choices, new resources, change their brain, heal. The illness is a teacher for us to shift. And then the third question, this is where the mindfulness comes in, and this is the paradox. The truth liberates, not your effort to be free. When I train doctors, they teach me how to do this. I don't know. Are you helping your patients be with their truth and live these questions, or are you engaging them to get rid of it and find the magic pill to fix it? No, it's in how can I be with my pain of mind and body and spirit in a way that is wise, compassionate, and healing. So, all of this, these questions, evolve out of an awareness, out of a mindfulness, out of the science of mind body medicine, out of the understanding of healthy aging, out of treating the pyramid and the traumas of life, not by years of therapy necessarily, but by relating to it in a different way and coming to terms and getting to know. I've had patients who were adopted, and I would be treating their ailments, whatever it might be, but I was aware of how important they needed to know who their birth parents were, where they came from, what was that was about, and whatever the difficulty. And the woman who I shared with you, who was the soldier with the dog, the dog didn't cure her of her story. The dog helped her change of how to be with it. She could be with it with love. She could be with the parts of her that were wounded and scared and carrying those traumas and pains. That's all. Not that's all. It's more complicated than that. But when you think about people committing suicide because of the trauma, because they weren't able to be with the truth of it, and that's the challenge, to get the support to integrate that. So
All
now
right.
we come
Healthy
to
aging. Yeah, healthy aging.
healthy aging. So these six pillars are healthy aging, whether we're 2 or 90. So this is the paradox, because we think aging. Oh, I want to get healthy aging because I'm getting old, and it's the same thing. Eat healthy foods. Yes, organic is better. Fewer chemicals, fewer additives. But you don't have to be crazy. You don't have to be a perfectionist. You slowly, over time, you integrate these components into your life. Number two is work the brain. Have the brain do challenging things like digital things, learning this and learning that. I think many seniors are challenged a little bit. I know I still am sometimes with online stuff and how to do this and how to do that, because I've had uh, a secretary and digital assistance my own career, and I avoided it. Now that I have to do it, I'm at a loss. So I run into trouble with that.
Can we
Okay.
go back to the eating and the supplements?
Yes.
So I know there are
Let
lots
me,
of
Sheila. Let
there.
me go through the whole first, and then we'll go back to that individual. I
Oh,
won't say
okay,
too much about it, but
okay.
thinking broadly, these are six pillars, six foundations, and they're basic in your lifestyle. What you eat, working your brain, moving, taking control of your health, dealing with your stress, take responsibility, as we said, sleep, and being social. Let's go back to the eating. Okay,
All
go ahead.
right, this one. Let's go in order here. Get moving. Let's
Yes.
start one. Okay, talk about that.
Number one is to move the body, exercise, take a walk, stretch, turn on PBS. Hopefully, it'll still be here. There's a lot of shows, yoga shows, stretching shows, fitness shows, a lot of free stuff online. You can go to fitness, the Medicare covers going to whatever fitness that you want. There's a name for the fitness app that you can get. So they're paying for it. So that's one way that it's changing, Sheila, is Medicare's recognizing if we want to spend less money on healthcare in our seniors, let's get them healthy. I get $5 a month when I call up my healthcare, my Medicare Advantage plan with United Health and tell them I went to the health club 3 times this week, and they give me $5 to spend
Oh,
on
we
whatever I want.
also have silver sneakers. Maybe
Silver
that's what you're
sneakers, that's
thinking
what I
of.
was
Yes,
referring to.
right.
So use it. It's so important to move your body. I I was playing, visiting my in a reunion with my childhood buddies. I think I shared with you from the neighborhood. We were playing pokers. I was one of the only ones who could shuffle the cards because my
Really?
hands were still. And I'm having trouble because of all the golf that I'm playing. That my fingers are able to to
Wow.
deal the cards. I don't know if that happens in mahjong, but
All right.
so that's an
So
important.
mental challenges.
Yes, use
We,
it or lose it. So remember that neuroplasticity?
yeah.
Teach yourself new things, create new pathways. One of the things that I like about embracing difficulty is this thing of taking in the good. You know, when we forgive, when we practice gratitude, but learn new things, seek out mental challenges, whether it be a crossword puzzle or a new language or take up a hobby, something that you're learning. Go back to being two. Think of yourself as two. You are still two. The body is still learning and growing and healing. Yes, it's worked hard for 80, 90 years, but it's still working. Those mechanisms are still there. Let's support it. Now, I've shared this with you. I just want to say this. This is, I don't want to name the drug or the medicine, but this is a context because before we spoke, and I know I was coming on today, I was listening to the TV, and last night there was a commercial for something, for a drug. And it was somebody smiling, whatever the ailment, I don't want to even say what it was. But then the rest of the commercial was talking about what it will do to you, and these are the likely side effects. And
Paul,
it
they
was doing
show these side effects with oceans and happiness things,
yes,
so you won't
yes.
really listen to it.
So I'm a naturopath. I am not anti-medicine, anti-doctors, anti-drugs. I take medicine. I go to doctors. I get tests. I want to see as I get older. I'm more conservative. I want more doctors because I want to get tested and diagnosed. I want to treat what I got sooner rather than later. I want to, etc. On the one hand, on the other, I want to also take care of myself as best I can, develop new habits, learn new things, eat better, eat healthier. I mean, I go to my cardiologist yearly and I have to confess to him. I say, I still can't give up bagel and cream cheese every once in a while because he
Of
yells at
course
me.
not.
I
Of
mean, how
course
am I
not.
going to
That's
not have a bagel and cream cheese? I mean,
Paul,
you
that's
know,
in your genes. You
that's in
can't
my
give that
that's
up.
in my genes.
You can't give
And
it up.
there's a joke, just if you didn't get the nationality or the background here. Uh,
Okay.
there's a joke that talk about in your genes. The Chinese New Year is like 3,000 years. The Jewish New Year is 5,500 years. What did the Jews do without Chinese food for 2,500 years? I don't know.
What did? Yeah.
We could have
Right.
started with a joke, but that's not
Okay.
one. Go ahead.
All right. So you were talking about others. Do you want to talk about the supplement that I know you feel is not
Well,
is
no,
fraudulent on the market?
yes, I'll mention it briefly
Okay.
because we can change our bodies, we can change our health by eating healthily. Go to the Heart Association, go to the Diabetes Association, go to the Lung Association, go to the Cancer Society. They're all going to talk about healthy food. That's it. And it will lower your blood sugar and lower your blood pressure and reduce your risk of cancer, etc., etc. Now that said, in the context of food, there are supplements, but that supplement means in addition to the six other pillars. When we substitute a supplement for that, and why do people take supplements? Look, I'm doing this 50 years, Sheila. I ask my patients, why are you taking that? Well, I heard that on TV, and my neighbor took it, and the guy at the Whole Foods said that to do that. My comment is it needs to be customized and individualized. Yes, there are basics that you're going to want to know about. Everybody knows about essential fatty acids are good for the brain and good for the heart for sure. So educate yourself about that. I'm not going to list the foods, but there are lists of foods for longevity. You can look it up. You can look at the books. They all say the same thing. What I want to change is your understanding and attitude looking for a magic pill that doesn't exist or waiting for the cure. The cure is the treatment and prevention through lifestyle to begin. And yes, supplements are important. You discuss that with your GP. You find a nutritionist, you find a naturopath, you find a health coach, you find somebody that you trust can guide you as to what might be appropriate from one small little multiple every day to others, depending upon your medical history, your life history. If you've had cancer, if you have heart disease, if you have high blood sugar, if you have high, that will affect what supplements you should be on, what drugs you are on. There are drug nutrient interactions, there are drug interactions, there are supplement interactions to take. You can't just listen to the TV and people hawking and selling and listening to somebody getting paid to say it works for me. Now, with that said, I want to make a particular commentary on the medicine, it's not a medicine, on the supplement Prevagen. This is my own personal commentary because I teach seniors healthy aging and healthy brain and healthy everything. And the first question everybody asks me is, should I take Prevagen? And it's a big button in me because I know what the research was years ago and it wasn't valid. It didn't do anything. And they advertised for years, take it for your memory. Then New York State and the Department of Consumer Affairs sued them and won the suit and says that's false and fraudulent advertising. So they lost the suit, but now they're on the air continually saying for your brain, for your brain, for your brain. They don't say what it does for your brain. The person says, it works for me, it makes me happy. Sorry for the phrase BS. It doesn't
Right.
do anything. There's no research that it does anything, but they're allowed to be on the air. And then because they've advertised and because they've sold it and because people bought it and because people think it works in some way, placebo, maybe that's a good thing to spend your money on. I think it's defrauding seniors and other people. And so did the state of New York
All right.
suing them. And this is the context.
Okay.
Now they,
Well, maybe
last,
other
last point,
state,
last
Paul,
point.
maybe other states will start to have
Then they
lawsuits against
advertise
them.
as the number one best selling supplement. It must be good. I'll buy
Yeah.
it. So
Okay.
sorry for that tirade, but uh,
Okay.
trust me, it's I'm working on it, guys, and
Okay. Let's
gals.
go on. Be
All right,
social.
be social, have friends, have community, be active, join clubs, go to the senior center. A lot of the students in my senior center, somehow they come to my class first. They've just lost a loved one, they've been home alone, and somehow they will call in and they're wondering what class should I go to, so they come to my class to support them to be with what they've been going through. And then from there, they'll take up knitting, they'll go to the exercise class, they'll learn a language, they'll make new friends, they'll go to dancing, they'll come to the show, they'll come to the movie, they'll engage. So being social and having community. Now, this is research, this is science, this is not a list I came up with off the top of my head. This is the Cleveland Clinic, the Mayo Clinic, the AARP, research, balance. These are the 6 pillars. More research in a pinky than all of the medicines that they're advertising and hawking on TV for you to take for whatever it is. So being social is critical.
Right. I think they've shown, Paul, and so many people are in the shadows, but social isolation, especially since we had COVID and now even after that, that is rampant in this country among the elderly. You live in a community that has a wonderful senior center and you do wonderful work, but how
Yes.
many people out there are in the shadows?
Well, what happens to a lot of people? They're in the shadows because they become caregivers for their spouse, and it can be a year or 5 years, and then when their spouse passes away, now they're depressed, and now they have PTSD from 10 years of caregiving,
Mm,
and they may be all alone, and so that complicates it. But what you said is true. Coming to the senior center is is very, very, very good medicine. I happen to be fortunate to live in a community that has a wonderful senior center, and they're all growing, and hopefully that's changing to offer that. It's not just a holding ground for old people to sit
right.
and be put when they're getting old. It's a
Get
place to
enough.
learn and live and grow, even with your losing your faculties.
All right.
This
Get
is
enough
critical too,
sleep.
making sure you get enough sleep, and having fun and having friends and being tired and being active will make you get to bed and go to sleep, number one. Dealing with your stresses will also help you go to sleep. And something important to say about sleep is to check to see if you have sleep apnea. It's a very undiagnosed ailment that helps the brain, helps oxygen to the brain. Next time you go to your GP, you can ask whether or not you're a candidate for a test to see if you have sleep apnea. It will really help in getting sleep and good quality of sleep. But each of these things are different for everybody. The challenge is for you to look at these 6 pillars and decide which ones are the most important for you, and get support at the senior center, with
Right.
friends, with your doctors. It's up to you. And this is the part we've been emphasizing: take control of your health. Okay, and go to your doctors. I have patients who, because they want natural medicine, think that that means they shouldn't go to the regular doctor. I'm not a regular doctor, and some naturopaths practice more as GPs. That's not my practice, but I'll see patients who are afraid to go to doctors because they don't want to take the drugs or afraid of finding what's happening out. And I'm saying, no, go to your doctor, have the test. You got to face that. And I'm assuming we're coming to the end, Sheila.
Well, in a couple of minutes. So,
The minutes.
tips for
Tips for
positive age.
positive aging. We've said it. And again, you don't have to be a senior. If you're listening to this and you're 20 years old, this is for you too. If you if you're a teenager, you know, this is for you too, for your grandkids, for your nephews. Care for your body, be a lifelong learner, strengthen your relationships, know your purpose, foster resilience, learn from your mistakes, right? Pain is your teacher. Develop gratitude, be thankful for what you have. Practice mindfulness, be in the moment, learn to live in the now. Set reasonable goals, go for your regular checkups, ask for help, seek support from a mental health professional if you need it. And these are wonderful tips for positive aging for everyone. And coming back to the end, so my career began, which is nice. So, Sheila, thank you. And Station, thank you for the opportunity. Began with how this quote inspired me. I read that book in the 70s, Healthy People, Disease Prevention, Health Promotion. I said, this is what I want to do with my life. You, the individual, can do more for your own health than any doctor, any drug, any exotic medical device. Paradoxically, one final point, it's not dissimilar to having the proper asset allocation for your age or whatever. It's the same. It's the same principle that one needs to individualize and customize their care to take responsibility. And for me, in investing, my investment advisor says, you're paying me not to sell your stocks when the market's going down because you panic and whatever. Paradoxically, I tell my patients, you're paying me not to cure you and fix you and heal you so you can do it yourself and do what you need to do for you. So I get out of the way, but I guide you to that. And when I mentor doctors and therapists, of course, they should do their specialty and do their thing and do it, give it to the patient. But at the same time, they can live those questions for the patient. How can you be involved? How did you get like this? What's this about? Where's the message in this? Can you be with this in a new way? Can your pain be your teacher? Can it guide you forward to a happier, healthier life, whether you're 2 or 90 or 100? And that context of Viktor Frankl, we have choices and resources. We choose how we're going to face our life, and how we face it is medicine. It's mind body medicine. Thank you
Okay.
for listening. And Sheila, thank you for
I have one more
inviting me.
question to
Sure.
finish up. So for somebody who is new to this philosophy, who's
Yes.
never really delved into these ideas, tell me the first three things they should do to become familiar with this philosophy, with some of the literature, with some of the ideas. What should I do? I don't never heard of this
You
mind
should,
body.
you
Tell us
should,
what to do.
you should talk to family, friends, and tell them that you're interested in however you choose to define what I said and how you speak about it. You should go online to YouTube and click in whatever holistic medicine, mind body medicine, mindfulness, 6 pillars. Go to the Cleveland Clinic. You should talk to your senior center. You should go to the library and speak to a librarian. Can you get me a book on healthy aging? Because there are zillions of them. The Ageless Revolution. You can enlist a friend to take a walk and discuss these things and explore with them your 6 pillars. Where there's a will, there's a way. And the challenge is to engage yourself as best you can. And if you go to doctors and health practitioners, you can ask them how they might support you to integrate some of these things or recommend someone. Maybe there's someone in their office that they work with that does ancillary or adjunctive care that could be helpful for you. So there's no limit to the possibility and options. There's no one right way. It depends on, start where you are, use what you have, and do what you can. Is the
Okay,
suggestion
great.
I would give.
All right. Thank you, Paul. I hope you've opened the eyes of uh, people to new thoughts about taking care of their health, especially because we're concentrating on seniors, so healthy aging as we grow older. But this philosophy can start when you're young. Of course, everybody can take advantage of these ideas. So thanks so
And and,
much.
and and there's science. There's not ideas. I mean, when I started, it was like, what are you talking about? This is science. This is on all of those associations. This is accepted truth and science, even if it's not practiced, because it takes a while for that to
Right,
evolve in that
right.
way. And
But as Joseph Califano said, coming back to him again,
yeah,
you are responsible for
yeah,
your own health, you and you alone. And good luck
right.
with whatever you choose to do with it to enhance your life. So thank you, Paul. Thanks, everyone.
I have
See
to
you
say one
next
more
time.
thing. I have to say
What?
one more thing.
Okay, one more.
Well, I'm I've been in the context of semi-retiring, meaning letting go and et cetera, et cetera. But after today's show, I recognize how much passion and purpose I still have, and enjoy speaking about this. So I think I'm going to keep going. I think it's an
Right?
important
Because
part of my
hopefully,
of
right.
my healthy aging. So thank
You
you
know,
again.
like when you're a teacher, if you reach one student, if you're a politician and one person makes that vote that lets you win, if you're a Dr. Paul Epstein and you help to save one person's life, you've done it. That's what you can do in
I
life.
appreciate that.
All
Thank
right.
you.
All right.
Bye.
Take care. Bye.
Bye. Thank you.